Okay. Yes, science fiction fans, if you can't tell. Every time I open this up in my company, they're like, what's that? And I have to go through like a half-hour description.
Gallifreyan.
Yes. So yes, hi, I'm Colin. Today's presentation is Healthcare, A New Hope. Hopefully you get the reference. So I am from Toronto, I am Canadian. By day, I'm the VP of Marketing at a company called Communication Solutions. It's a $2 billion company. Most people know us as the box that's on the side of the exam room that you put sharps in. It's the same company. except I work for the healthcare IT division, and that's the communication solutions division. So I'm in healthcare IT, and so I was asked by Regina to come today and talk a little bit about some of the things happening in healthcare IT and how that's going to impact all of us as patients. I am the co-founder of HCLDR, so just a little plug. That happens every Tuesday night at 8:30 Eastern. It's been going on for a few years now. So if you've never joined, it's a great way to come and kind of voice your opinion about all things healthcare. We have some amazing guests and speakers on, and I highly encourage you to come by. This is my second Cinderblocks, and I'm very happy to be here. So, what is my message? My message today is really a message of hope, and it's not simply because we have this guy as our Prime Minister. Probably easy for me to say that, especially when he's able to do that, and of course when he and his wife look like this. So, yes, we are kind of. It's been a while since Canada's been talked about, and I know this is, we're gonna take it. We'll take it. So, what I'm going to talk to you about is really the merging of 4 trends. As part of my job, I get the opportunity to go to a lot of conferences. I hear a lot of speakers, go to a lot of trade shows. It's a lot of time on the road. Being on the road, though, allows me to hear a lot of perspectives from all across the healthcare spectrum, and I kind of put together 4 trends that I'm seeing just based on the last year of travel and all these conferences. So number 1, real-time, near-perfect self-health information, care anywhere, high-deductible plans, believe it or not, is a trend, and health as wealth. So how do these all work together? What's that going to mean? Well, let me talk about that. So, real-time, near-perfect health info. We are very, very close, just a few years away in my mind, to having almost perfect information about yourself, right? We have trackers that track everything from how much you walk, how much you sleep, whether you're stressed. We even have these new food scanners. I don't know if anyone's seen these things. The CO food scanner. It's a molecular scanner that you point at food and it'll tell you how many calories it is. It'll tell you whether or not it's ripe. It'll actually even tell you whether or not you should eat it if you punch in your allergies. So it's a molecular food scanner, and it's the size of a USB drive. It's amazing. So it was revealed at CES this year in 2016, and it's coming soon. Right? So now you can have basically perfect health information. You'll be able to track what you eat, your calories and all that stuff by just scanning things. You don't have to type things in anymore. So we're going to have so much information about ourselves. And we have so much technology that's coming to help us even track all this stuff. Nike is just producing a shirt that you can wear for athletes that will tell them what their heart rate is. And it'll store the information, and not kidding, it will download it while it's in the washer. Right? If you have a Nike clothes wash. So what does this all mean though? It means that in a couple of years we'll have more information about ourselves than all of healthcare has about us. So we will actually generate our own information, and we'll generate more of it than actually what our hospital and what our doctors have about us. We will know more. We'll have access to knowing more. We won't, unfortunately, probably have access to our EHR. That's probably still going to be a problem. But we'll have our own data. Right? We're going to have a lot of this stuff. And what this means, when we have all this information, is that we'll know the baselines of our own health better than our providers will. We will know the impact of certain foods on our body more than our provider will, right? Because we'll monitor in real time. I know when I eat this apple, I got a sugar spike that happens an hour later and I don't feel good, right? Or maybe I'm allergic to it because every time I scan this particular food, an hour later I can see my heart rate go up or down, or how this gets impacted. That kind of information is not the information that your doctor will have. It's not the information that your hospital will have. But we will have it. And we'll get this insight through personal data mining, or big data for yourself. We don't have these tools yet, but it's coming, right? You look at Fitbit, and Fitbit's kind of got bits of this stuff already, where it tracks all the fitness stuff you do. It can analyze the sort of best times for you to do your exercise, the best times for you to go running. All right, so we're getting close. So this is what I mean by this sort of movement or trend towards near perfect real-time information about yourself. And soon, you won't need access to your EHR. You'll have it. It's all there for you. Right? That's actually the access that I think we're going to get. Because wait for a hospital is probably going to be a little bit longer than a couple of years. The second trend is this trend of what I call care anywhere. And what this is sort of, there's a couple of trends in here, but one is the fact that we have increasing access to high-speed internet, and we have video streaming now. It's pretty common, and of course what that's led to is an explosion in telehealth. Right? So now you can see a doctor virtually, you can see a specialist virtually, even though you might live in a rural area or not have access to specialists in your local hospital. You will now have access, and the growth of telehealth is quite stunning. The number of people seeing, a number of visits happening via telehealth technology is growing exponentially. As well, from our friend Dr. Eric Topol, he talks about the fact that you're going to basically have a physician in your pocket, right? With the smartphone, it's going to be able to diagnose you with a variety of little add-ons, right? So we have the is it called Scanadu or Scanadu?
Scanadu.
Scanadu, right? The Scanadu unit, that's this little white unit. That's up here, you put that to your forehead, and it's basically like a tricorder from Star Trek. It can tell you all these different things about you, your temperature, and so all these kinds of tools will allow you to basically take care of yourself at your schedule, on your time. You don't have to go to a brick and mortar organization to get your care. And this is new. I mean, there's tons and tons of innovation happening in this area. Lots of different devices were revealed this year at CES, which is the big show in Las Vegas. Just around this, about keeping patients at home and giving them the ability to diagnose. And now combined with telehealth, you can take that information and share it with your provider over the web and then get help that way. The last sort of trend inside this care anywhere is the rise of patient communities. I have to give a shout out to the breast cancer social media group, who unfortunately lost one of its founders recently. Yesterday, yeah. So Jody unfortunately passed away. She was one of the three moderators, founders of that wonderful community. But patient communities in general are on the rise, especially ones focused around diseases, rare diseases, common chronic conditions, and you see them all over Facebook. Patients are now getting to the point where they're more educated than certain providers are about their own conditions. And the advice coming from patients who are really doing the research actually trumps that of most researchers. So patients are now increasingly turning to their peers and going, you know what, I trust this person, I can see that they're out there, they've put all this information, they're read up on all of this research, I'm actually going to trust what they have to say and what treatments I should be looking at, and I'll take that information and bring that to my provider. So it's a real change that's happening now out there, whereas before people were like, no, don't read that stuff, it's not peer-reviewed, and you don't know who that person is. Well, that's changed. We've had years now of social media. We've had a lot of people sort of rise to say, well, these people actually know just as much as some providers do. And so I think the patient communities allow patients to have care anywhere. They don't have, again, you don't have to go to a hospital, you don't have to go to your provider in a bricks and mortar place. Not to say that they don't have a place they're needed, it's just that now I have a choice, whereas before I didn't. So that's trend number 2. Trend number 3, high deductible plans. This is actually one of my favorite topics because this is very fascinating as a Canadian, right? Because of course we have universal health care. We don't see the costs, it just comes out of our taxes, which are absorbent. But at any rate, the theory behind high deductible plans was, this was a couple of years ago, it came in like bending that healthcare cost curve. That was the whole point of having this high deductible plans. We're going to reduce the cost of care by actually just pushing the cost of care to patients. That was how they were going to bend the curve. So that was the theory. The reality was that people are actually just foregoing care. Right? A lot of the latest studies are saying that those people on high deductible plans are just choosing not to get health care. Now, that's pretty horrible if you think about it. It's probably not what they intended to do, but in a weird, bizarre way, it's actually causing an unintended consequence that we're seeing, that I'm seeing anyways, which is it's actually increasing health literacy and price transparency, and here's why. So it's basically forcing people to balance their own cost versus care equation. So when you make the decision not to get care, it used to be, well, do I feel sick enough or not? Now it's more like, well, is it worth it? Right? Because you're going to have to cover the first X of whatever the cost is. So now people are going through their minds kind of making that comparison. Now, I don't think they're fully educated enough to make that. Like, is $5,000 worth an extra year of life? People don't even know it's going to add a year of life. It's not proven it. So it's a bit fuzzy, but it's causing people to think like this in their minds. So when you get into these high deductible plans, now what happens is if I'm making this sort of debate in my head around cost versus care, what am I going to do? I'm going to go and comparison shop. And so I want to find out, well, if I need to have this done, I need this treatment, I'm going to now look around for a couple places that may offer it cheaper. Because I have to stretch my dollar a little bit. So in order to comparison shop, what do I have to do? I have to obviously learn about all the different treatments. I have to learn about the quality of the providers providing those treatments. I have to read up on my condition. So in a weird and bizarre way, high deductible plans are increasing health literacy. Right? Because I'm forced to. As a consumer, I'm going to read up on this in order to make better decisions. It's not happening overnight, but it's happening slowly. Because now all of a sudden it's hitting my pocketbook. The second sort of unintended consequence of high deductible plans is that it's turning providers into collection agencies. Right? So hospitals now are scrambling to figure out how to collect this money now from patients. This is not something they're used to. They're used to submitting something to a payer, and then magically the funds appear. And they have this electronic clearinghouse system. There's like ways to negotiate claims, but now you got to collect money from a patient. And that's new, and that's scary. And so hospitals and providers all over the place are now offering finance plans. People are now realizing, boy, if I don't collect, I actually don't make enough to run my practice, so I really have to get on this. And smart providers, what they're realizing is it's much better to tell the patients up front what their costs are going to be and to offer them payment options up front. But in order to do that, of course, what do you need to do before you can tell this to a patient up front? Of course, you need price transparency. You need to have an accurate description or an accurate accounting of how much a particular procedure is going to be. So in order to avoid the collection problem, there are some now new studies coming out. I don't have a reference, but there are some studies coming out that say, look, if you talk to patients up front about the cost, they're actually more likely to pay the bill. Because the number one reason why patients don't pay their bill is not because they're not capable of it, it's because they don't understand the bill. And they don't understand why this was necessary. But if you explain that up front, they look at the bill and go, oh, this is what I expected, okay, I'll pay it. So, the unintended consequence of this is that we're starting to get more price transparency. The smart providers out there are putting their information out online, or at least discussing it with you in a consult prior to treatment. And that's price transparency is something that a lot of patient advocates have been asking for a long time. And it's going to be needed in order for you to make the decision of where to get your care. So the last trend that we are starting to see, and this is more of a social one, a cultural one, is this concept of health as wealth. Right? So culturally, we're all becoming more like Californians. Right? And what I mean by that is we're all becoming health eating, health monitoring, exercise-focused people. Right? It's a social trend. We're all anxious to become more healthy. So it's certainly happening in my social circles. I think a lot of people will agree that people are now starting to talk about not like what car they drive or like where they lived or like where they took a vacation. They're actually talking about like how many marathons they've done or whether or not they've been training for this Ironman or that Ironman. Like people are starting to talk about that as social currency as opposed to actual currency. So people are talking about these health-related and healthy behaviors and using that as status. And I think it's actually a good thing. It's actually amazing because anybody can do this in theory, and you don't have to be uber rich in order to be, have this kind of status. In fact, it's almost flipped on its head. People who are uber rich tend to not to exercise very much, So health as wealth means that I like it because it's also more sticky than it being a fad. I think we've had a lot of diet fads, a lot of health fads, but health as wealth is really starting to become ingrained. People want to live longer, they want to live healthier for that time that they are, that they're here. And so I think it's a true trend. It's not a fad. Now, it wouldn't be a Star Wars themed presentation without me talking a little bit about the dark side. So the dark side of health as wealth is that, of course, like the social economic divide that we have between the rich and the poor, we will soon have a health equivalent where there are going to be people who just cannot afford to be healthy, who are working 6 jobs just to get by, and of course they have no time to go bike riding or to walk in the park or can't even afford to go to the park, as we heard already this morning, and versus those that can afford to do that. So there's going to be this health divide, which is unfortunately a lot harder to bridge than a social economic one.
Yeah.
Right, so that's going to be a problem. I don't have an answer. I'm just highlighting that the dumbbell effect, the sort of thinning out of the middle class, is eventually going to happen. We're going to have a lot of people who are really, really healthy. We're going to have a lot of people who are not very healthy, and then there's not going to be this sort of middle ground, which poses some interesting questions for our healthcare system, because I think they're used to sort of the middle. They're used to, I'll see you once a year. You're pretty healthy. I don't have to worry about you. But now you're going to get people coming in for I need an ACL surgery. I need a knee. I need to I want to run more marathons. You got to get me that knee surgery, and all these other things are going to start to happen. So it's interesting times. So hopefully one day someone will give me credit for this decline of the healthy middle class comment. But you heard it here first. The comment. Just wanted to say that. Royalties are welcome. So just in summary, so these are the 4 trends. So again, I talked about the near perfect real-time health information through all the different devices that we're going to have attached to ourselves or going to wear. Care anywhere, in the sense that you can get care anywhere you want, at any time you want, through any medium that you want. High deductible plans, causing us all to be more price literate and health literate. And this concept of being healthy as being more wealthy in our society. So what is this all leading to? Sort of the great hope that I have for all of this, it's this, is that we're really finally going to get to the rise of the self-aware patient who owns and analyzes their data to determine the unique path to wellness and health, and in turn uses that information in their own health ecosystem of their making, not of a payer's making or an employer's making, but of their making, in order to achieve the level of wellness that they desire. That is sort of where a lot of these trends are kind of pointing to. And it's unintended. I don't think any one of these trends kind of set out. I don't even think the government set out to do this. But because of the sort of confluence of all these trends, I think this is actually where we're going to be heading over the next couple of years. So that's my little story. That's my little trend discussion for this morning. Any questions?
Well, do we have any questions? Because Colin finished up a bit early.
I time myself so I can answer.
I see some questions.
Yeah, so with the high deductible plans, as somebody who's also been on them for a long time, I do also find myself realizing, well, something's really expensive and putting it off care too. Like, is that kind of the flip side of what you see with that too?
Yeah, that's exactly what's happening right now, is people are putting off care because they can't afford to do it. What's interesting now is that some payers and some employers are actually encouraging people not to put it off by offering them actually discounts to do it now as opposed to putting it off. So these are for non-elective surgeries that mostly related to sports injuries and things. That where they go, well, if you wait 5 years, I know it's going to cost me actually twice as much to have you do it then. So actually, I ought to pay you to have it done now. That's actually starting to happen with some employers. So yes, you're right. Right now, the trend is I want to do it, but they can't afford it though.
Yeah, and the employers that are doing that, the smart ones, this is a very small subset, but the smart ones are negotiating with providers to provide affordable care in those, like say knee replacement or like whatever. So because that they recognize that they're only screwing themselves by making setting up a system where people just delay care.
Yeah.
Not only that, but they're allowing people to travel across the country.
Or
have some of those procedures.
Go to Thailand, man. Everything's like 10% of what it costs here, and the food's better.
far. Not quite that far. Still
Oh, that will
staying
happen though. That
I'm
will
sure it
happen.
will, but it's still
A lot of
primarily
people
US.
go to India.
Yeah, that's actually another issue. I didn't put it up here because I didn't have the right stats, but medical tourism is growing because of these high deductible plans to other countries, especially Thailand, Singapore, and others. Again, mostly for more expensive surgeries here in the U.S., not for more common ones, and it's not, you wouldn't fly that far for it. But also economically, what they're finding is when you go over there, the patient experience is better, right? They put you up in a nice hotel, and everything's taken care of while you're over there, and then you fly you back. So that's going to be very interesting to watch over the next little while as well as tourism. Yeah.
I wanted to ask you, is that doctor in your pocket stuff actually happening in Canada? Because I've tried to do that, like with my shrink or with my neurologist or with all the other doctors that don't actually put their hands on you, but just make you sit up on that stool thing and ask you questions of just like, oh, how are you doing? It looks like you've lost weight. Oh, it looks like you got your haircut. Stuff doesn't, and they can see that through my computer or even through my FaceTime, whatever.
Right.
But they're like, oh, we can't bill your insurance if you're like through the phone, or we can't bill your insurance if you're just through the computer. And I'm like, just bill them, like tell them I came or whatever. Like I don't, it's just across town, so it's just really me being lazy or like me not wanting to go. But it's also like, why can't we do this through, why can't we have these visits? Like I just need like a new prescription. Like I'm fine, I'm just out of meds. In a couple of days I won't be fine. So if you could just send the prescriptions over or just call them in, this is all going to be fine. But they want to deal with healthcare. That's all. I feel like that's all they want to do.
Carly's dying to respond.
So I actually have sort of like a low-tier concierge medicine primary care doctor. They're a chain called Low Medical, and they charge like a very reasonable membership fee, and they use that money to compensate for visits. And I have an app, and they can do a video visit, or you can send them pictures of the paper rash. But what the problem is that most insurances, they don't reimburse for that sort of scan. So it's like the technology has outpaced the reimbursement model. So, and I actually just had insurance, like the insurance for the day, say, sign up for Blue Cross Blue Shield, has their own video visits you can use, but they're sort of setting up
Those are
a minute
really
clinic.
high premiums.
Yeah.
Really, they're like $400 a month, which like,
Yeah, but I mean, like, there are options out there, it's just that the reimbursement is kind of always caught up to technology.
So,
I can't comment on the Canadian experience. So in Canada, yes, we do have free healthcare, and that means you can go to see a doctor and go to the ER anytime you want. It has obviously the effect that most people think about when they think about Canada's system is we have huge wait times. Right? We have wait time crisis all the time. So telehealth and technologies like like on your smartphone are actually being adopted very quickly by Canadians because of this wait time problem. So it's not so much that it's affordability, it's really more, I just don't want to wait 3 days to go and see a specialist. Or in fact, it's months to go see a behavioral health specialist.
For certain specialists here, it's months also.
Yeah, so we're seeing it definitely telehealth get picked up in those areas where there's a lack of specialists. I'm spoiled because I'm in Toronto, so there's a lot of specialists, but outside of the major cities, it's very, very difficult. And so we're seeing this uptake, and thankfully our government is also realizing it's cheaper for them to pay for telehealth visits than actual visits. And so they've actually implemented this year under Trudeau's government payments for a lot of telehealth visits now. And so there's that's sort of fueling a more explosion of telehealth practices. There are some doctors that I know that do nothing except telehealth visits, which is amazing.
God bless them.
Yeah, and yeah, they have patients, because of the way the Canadian rules work, but they're even starting to talk about relaxing the rules between provinces so that doctors can practice in multiple places, because you got tons of specialists in Toronto who can see people in Alberta, right, in these sort of very, very rural regions, so. But we're adopting it for very different reasons. Sure.
Okay. So I think this is on the surface a very wonderful thing, right? That software patients analyze their own data and create their own health ecosystem to choose their desired level of wellness, right? And I think that there may be people in this room that will work, right? But there's a lot of people, and people notoriously lie to themselves, right? People have all kind of biases that are based on emotion and that aren't based on data. And I can talk about my own family, right? You know, are there ways to balance out the, hey, I'm going to do it alone based on my objective review of my data and my accessible ecosystem and my wish to be healthy?
Yeah, I think, so here's where it gets really interesting. So I think there was a study that was done by I think it was Fitbit or somebody like that, that basically, you know, they gave away all these devices to people who didn't actually consider themselves very healthy. And it was just, you know, you had it, and then this thing automatically uploaded it to your Facebook. And then what happened was that people started to realize that, oh man, like I really don't walk very much, or actually I walk a lot, and they were able to establish new visions of themselves in terms of their healthiness or relative healthiness. So where I'm going with this is I think, like everything is now got a, you know, it's got a tracker in it. You're going to be exposed to this health data, whether you meant to track it or not. It's going to basically tell you. Your car is going to tell you whether or not you're sitting in traffic too long. You know, your cell phone tells you whether or not you've walked enough. So I think in terms of the collection of data, we're going to be collecting it. What you do with that data, now I think here's where it gets interesting, because there are some companies, some startups in Silicon Valley who will essentially take all your health data and all your I'll call it social data, like when you eat and when you drive, and they'll match it for you and then spit back a report for you. It's not healthcare related, so they're kind of getting by the FDA and all those sort of medical rules, because they're just basically saying, hey, looks like you like to walk at 6 o'clock, and maybe you should do more of that, because when you do, here's what happens. I think that's actually going to become business, that people are going to be in this business. I think that'll help with what you're talking about. But yeah, this is where that divide comes in. There'll always be people who just go, you know what, I'm not into that, I'm fine the way I am, I don't need to track everything, and they just won't participate. I just think it becomes pervasive. Yeah, it just becomes pervasive. I mean, my TV, literally, I got the thing on my TV where my kids are watching certain channels, it'll warn them, and it puts this big block on it and says, you've been watching TV too much. My TV monitors how much TV my kids are watching. That's amazing, right? So, and you know, you've got all these things in cars now for you can set the age. I don't know if you've seen these things in the new, I think it's the new Kia. So you can give your teenager a certain key, and when they insert the key and they drive, it won't let them actually turn the car on past midnight, or past certain times, or it gives you a warning, or it doesn't allow them to drive for a contiguous amount of hours. It prevents them from doing that. It'll actually give you warnings and beeps and things like that. It's pretty amazing. Anyway, sorry, I digress. Getting turned on by technology. Yeah.
About the price transparency, I wondered if you'd seen the video of the guy whose life was expected, and he was trying to track down how much it was going to cost to have a baby in the hospital.
I didn't see that, no.
It's like BuzzFeed or something,
Okay.
but it's really interesting. Basically, the answer was, it's
You
not
could-
possible.
It's not possible, yeah. And it isn't. I mean, we're far away from price transparency, but I think that's certainly for, maybe not for, hopefully not for pregnancies, but for more complex procedures, for sure, I don't think we're going to get there very quickly. But for some common ones, I think we can. And I think it's more the small providers that are realizing this. The big ones are just going to take longer to change. But I think it is happening, because if I have, like again, if I have to pay something out of my own pocket, I don't know how much it's going to cost. And I may not have to comparison shop today, because maybe I can't, but at least tell me what it's going to cost before I walk in the door, before I have the procedure done. That's sort of now becoming demanded by payers and by patients, which is pretty cool. Casey?
The issue with childbirth is that as soon as you go through the doors of a hospital, you have entered Kafkaville. In other words, someone could have given you a number prior to your going through the door, but there's going to be like 8 people who are going to come in. You may not even see them, but they're going to be on your bill, and nobody's going to have factored them in ahead of time.
Exactly.
So for childbirth, your best bet is use a doula, find a birthing center, and get a one-off charge from an OB-GYN. Done. And pray for no complications.
I mean, I don't know if it's going to be Canada or Australia, or maybe it's going to be some of the Nordic countries that's going to be first, but you know how we have the rules of when you bring your car in, right? You get an estimate, and then the actual bill can't be above or below a certain, can't be above a certain percentage of that estimate. It wouldn't be wonderful if that ever happened with healthcare. I'm pretty sure some government out there is going to do it. I don't think it's going to be Canada.
Well, the $3 trillion a year in this country, we got problems.
We do. We do.
Thank you
All